2, 3. Hello, everyone. I'm Gloria Salazar, interventional radiologist. I'm with the VLU Voices today, and we are going to be presenting the top 3 highlights of the VIVA meeting that was held last month in Las Vegas. And I'm here joined with my colleague and friend, Kathleen Osvat. Kathleen.
Hi, Gloria. It's so nice to be here with you today. I'm Kathleen Osvath. I'm a vascular surgeon in Albany, New York at St. Peter's Health Partners. And I had a great time with you at VIVA. It was great to be there. I think there's no way that we can start this discussion without talking about Steve Elias. He won the award and it's so well deserved. He's a true educator. He is just an amazing person, and he's done so much for the advancement of venous disease. Don't you agree?
I absolutely agree with that. And I actually met Steve, I think 5 years before COVID, and I've learned so much from him. And what I love about his teachings, which I think we can call it his teachings by now, because we all learn from him, is that his main focus is obviously the patient. And I think we're all focused on the patient, but we sometimes lose sight of, the outcomes and the data, but really, what are we trying to fix or solve for the patient? So for me, that's, really going back to basics almost, but really needed in these days, in these times that we're talking about technology, AI, and how many devices we have available. So he's been great, and it's so well-deserved award. I was very glad to see him as the recipient of this year's VANES Innovator Award.
Me too. Me too. Well, I think we should just hop right in. Do you want to go ahead and talk about the next topic?
So there were amazing things. I mean, VIVA is one of those state-of-the-art meetings that we always learn something, whether you're junior, whether you're senior, whether you're actually like a PI in a trial, and you get so much feedback from. So, however, for me personally, for the sessions and the talks, I really love the anticoagulation talks, and there were 2 flavors of that. A session that is all about clots, and in that session, I love the talk about Aditya. He talked about antithrombotic therapies post DVT, which is so much controversy about what do we do, one anticoagulant to use, and we have so many options on today's world. And also, I love Scott Cameron on talks on thrombophilias, and that was actually how to manage thrombophilias was in the session that was moderated by Raghu Kalori. And I thought that was the best session of VIVA. And that session was dilemmas in diagnosis and management. And we had so much talk about medical therapy for venous disease and, diagnosis of and treatment of splanchnic and cerebral vein thrombosis. And that was one of the best talks by Geoffrey Barnes, our colleague. And so I think these 2 were my main sessions that I loved the most.
Gloria, I completely agree with you. I think that we as proceduralists, we're good at intervening, and we're good at offering appropriate techniques and technologies. But one of the things that we always need to keep a mind on is the medical management. And I always sit there in these talks and listen to them, and then when I hear the discussions that come about, it seems like everybody does things differently. So it is so nice when people really pull the data together and then are able to talk about what they think works the best. And then I always learn something. And one other thing that I find exceedingly interesting that I really have to admit I didn't know much about are like the venoactive drugs, which is a huge topic. And unfortunately in the United States, they're not as mainstream. So again, learning about all these things is always such a plus at VIVA and at other conferences as well.
And since you mentioned, Dr. Fukaya gave the talk, and it was really amazing. And I also want to mention here Dr. Monica Glavinsky, who has been a huge advocate, and I just want to formally thank her, because I think with her, I really got introduced to this concept of medical therapy, although I did have, like you, a lot of Hispanic patients or European patients that were already taking those supplements, really. And so I think we have a lot to learn, and perhaps even in controlled research trials, we need to perhaps focus on that moving forward. So that was great. Excellent session, excellent speakers. And just to complement what you said about the medical management, you're right. We know how to do the procedures, and you know how many times I'm asked to do a portal vein thrombolysis. And I'm thinking to myself, I think this needs to be medically management. So thank you, Viva, and thank you, Geoffrey Barnes, for this talk, because now I know what to tell my colleagues and how to manage it. So well done, from clinical to management and procedural management. So now I like to say that VIVA is also a platform for giving updates or providing us updates with the latest and the newest in the venous world. And I think it would be, to end this conversation, I think it would be interesting to talk a little bit about the updates on the PE trials. We have so much going on. My colleague, Dr. Aki Sista in New York, is leading one of the major trials in this topic, the PE track. And in his updates, he really is looking for really truly a national collaboration of enrollment of those patients, particularly because I think his points in this update sort of talk that he gave at VIVA were that this is a trial that is sort of regardless of industry, we're doing this together for the clinical outcomes. And we're looking at clinical outcomes that really matter for the patient, functional activity, things that we have not have been able to answer in the long run. We focus so much on the LV, our VA ratio. And we feel that at this point, given that we're all treating those conditions, we need to get better data that actually support patient outcomes. So I thought it was really great. I hope that people and anybody who is doing those procedures consider enrolling in this trial as a site. And I know that the information is available online. And that was a major thing for me to see happening after 20 years or so of practicing, that we're actually doing something good for the patients with pulmonary embolism.
It's so important to get that confirmation that we already kind of know from our own practices, but when it's in print and you have solid data, you know that it just confirms that you're doing the right thing. I completely agree. There were also some other interesting trials. There was the 1-year clinical outcomes of DVT management with mechanical thrombectomy, analysis of the clout registry that David Dexter presented. And this was very interesting as well. Of course, there's always controversy over DVT management. So it's kind of nice, again, to see what the data is and what they did and what their results are now. And then, of course, going from that then to stents, like the iliofemoral vein investigational clinical trial, the VIVID trial that Dr. Razavi presented. What are your thoughts of that?
I think that's really interesting. Both of these. So I think what is interesting is this: we have an amazing specialty that has so much refinement in devices, and now we're seeing different devices that we did not have 10 years ago. And both of those examples that you're giving us, like before we would do lysis, and now we're focused on mechanical thrombectomy for DVT. Right. So what are the outcomes of those trials of these different devices? Similarly, with the venous stents, we were practicing with non-dedicated venous stents for so many years. And I think that the dual venous stent just adds to this whole host of data that we're seeing now for these occlusions and treatment of patients with iliofemoral occlusion. I think that anything that we can do to help those patients, particularly in the post-thrombotic syndrome sort of state of disease, it is really important. I'm actually looking forward. I know that we have a lot of devices. I know we have like a explosion of devices, but as long as we are using the proper metrics and looking at different patient populations, I think that's the key here, because not always we're going to have the classic presentation. We also have to deal with situations that are outside of the clinical trials, or maybe we can look specifically at different populations. So I really enjoyed the late breaking abstracts focusing on different technology and how do we go about evaluating those new technologies.
One of the papers that I listened to Dr. Dexter give, the bullfrog one, and I think that that is a really interesting idea where they're looking at local inflammation and then injecting medications locally into the veins. Well, first of all, any child that has the PI's name in it, that just made me laugh and smile. You know, it's called the Dexterity Trial, and it's David Dexter. So he does such a beautiful job with research, and it'll be interesting to see how the use of medications, if you will, in an area that's inflamed. Maybe this is not going to be the end all, be all in the end, but it's very interesting, and I have to give him a lot of credit for working on this and seeing what happens and what works.
Completely agree, Kathleen. I think that honestly, this is why VIVA is such an amazing conference. We started including in the talks the role of inflammation through the program. You see that there's talk, there's obviously Dr. Dexter is doing research on the field, and for us that are probably not doing at that level of research, we really start thinking like that is the reason why some patients respond so differently to the stent, for example, to the stent placement. Maybe there's intramural hyperplasia that is more prevalent in certain patient populations, and perhaps the inflammation is the answer. May not be the answer to all of the questions, but certainly it's a great start for us to start looking at this disease process differently.
Yeah, I think the other thing where we have a deficit, and I always love hearing Steve Abramowitz speak about the new device from Inari that the RevCore device that actually cores out the stuff that builds up and causes stent occlusion. Because you and I both know once that stent is occluded, it's really tough, and sometimes you don't even get across it. So I'm really hoping that technology is going to become, something that's usable. Again, technology keeps getting ahead of us and just going forward. So who knows? But that seemed to be a very interesting talk as well. I always love to hear Steve speak.
He's an amazing speaker. And I think that the value and having such a device will pay off. I don't think we're seeing the whole effect of all those years of stenting that we have done. And I say we because, this is an evolving field. And again, this is why it's so important to have the conferences and this research ongoing. And unfortunately, I think perhaps you and I are biased in our practice. We get those patients and what to do with them. This is the end of the line for them in terms of different referrals. And we really have challenging patient population. I think having a device like that would really change the landscape in those patients who have nowhere to go, really. Nothing can be done for those occluded stents. It's really hard to deal with it.
Yeah. I think the one other thing that I really love when I go to VIVA is hearing and talking about difficult cases and how people get out of trouble. I feel like I have to thank, all of these experts, you included, because when I hear you guys give these presentations, I learned something and I can take it home with me and I'm able to use what I've learned.
Well, yeah. And when you see in the panels, when you see the experts actually going up for asking questions, to ask questions like Minaj, Kush, I actually took a picture of them in line to ask questions to the panelists. So I think that goes to show you our growth mindset, really we all learn from each other, and it's amazing to be together and discussing the challenges that we face.
Well, I really look forward to seeing you at whatever next meeting you and I are both at, but definitely next year at VIVA.
For sure at VIVA, but most certainly also that we're going to have other opportunities. And thank you everybody for listening, for following us and VLU Voices. This is really meant to everybody who is looking for updates. Maybe you didn't go to the VIVA conference and you just want to know what's going on, what is the latest and greatest in the venous disease. So thank you, Kathleen, and have a good day.
Thank you, Gloria. Bye.
Bye-bye.